Good morning. Can you hear me?
Yes, we can. Thank you.
Great. Oh, I'm having issues forwarding my slides. Hang on one second, please. Sorry.
You're fine, Joe. You're all good to go?
I think we're good. Sorry about that. So we know that many students with asthma struggle to succeed. And so I'd like to start by telling you a little bit about Joshua. Joshua is our 9-year-old student with asthma who's had multiple emergency visits in the past year. He has difficulty sleeping at night because of nighttime asthma symptoms, as well as frequent absences from school. His teacher also reports that when he's in the classroom, he has poor attention frequently, and his mother reports inconsistent adherence with his daily preventive medications. And I'll come back to Joshua in just a minute. As you heard earlier, we know that the burden of asthma is substantial. It impacts as many as 1 in 11 children, representing nearly 7 million children in the US, and over $50 billion in medical expenses annually. We also know that there are substantial disparities in asthma in that the prevalence is higher among Puerto Rican children and non-Hispanic Black children, and it's also higher among children living in poverty. As you heard, asthma has a substantial impact on schools. It's the leading cause of missed school days for children, but it's also associated with poor sleep, limitation of activity, poor school performance, and it's important to note that asthma can impact all members of the school community, including not only the children, but the school nurses and teachers, the bus drivers, the coaches, and really all members who are on the school grounds. On average, 3 children in a classroom of 30 are likely to have asthma, and these rates are even higher in high-risk urban settings. 13.8 million is the number of missed school days among children with asthma. We also know that guideline-based asthma care can improve outcomes for these children. The National Asthma Guidelines from the National Heart, Lung, and Blood Institute recommend a daily preventive medication for all children with persistent symptoms, as well as adjustments in those medications for any child who continues to have poor control. And importantly, these are medications that work. They've been shown to improve outcomes and reduce asthma attacks that can lead to hospitalization. But we also know that inadequate therapy and poor control is common among these children. In this study of almost 1,000 children across the US, all of whom had persistent asthma, we found that only 20% were optimally controlled on a preventive medication. Another 37% continued to have persistent asthma and reported no use of a preventive medication, and this represents preventable morbidity. We also found that 43% had poor control despite reporting having a preventive medication, and this likely represents poor adherence, ongoing exposure to environmental triggers like smoke, or both. So the question is how to address these gaps in care. And we have used Wagner's chronic care model to think about the essential elements of the healthcare system that encourage high-quality chronic disease care, thinking about the health system in the context of the community. The goal is to ensure access to services that we know improve outcomes. So in this case, we focus primarily on those medications that we know can work for children with persistent asthma. We focused on schools because we and others have shown that school-based programs can improve outcomes for these children. School-based programs provide the opportunity to identify high-risk children and build optimized systems of care in the setting where they're spending much of their day. Our preventive care program for urban children with asthma represents a partnership with the school nurse program where we can give preventive medications daily through directly observed therapy in the school nurse office and adherence can be assured at least on the days the child goes to school. And we've also incorporated in treatment adjustments for any child who continues to be symptomatic despite receiving their medications consistently. Our school-based asthma therapy trial has shown a 25% reduction in symptom days, symptom nights, activity limitation, asthma attacks, and days absent from school. We've been fortunate to be able to implement this program throughout the Rochester City School District, which is a high-risk urban district where most of the students are eligible for free or reduced price lunches. And we've worked with more than 60 preschools, elementary schools, and secondary schools in this area. We've also been so excited to see many of these programs pop up nationally that are focused on school-based asthma care, many of which are based on these types of programs. And importantly, the National Association of School Nurses now includes school-based care in part of their asthma care guidelines. In thinking about the scalability of our programs, we've used telemedicine as a mechanism to link children from schools to their primary care site in order to get the appropriate preventive medications prescribed that can then be implemented through directly observed therapy at school. Telemedicine allows us to provide enhanced access to children who may have difficulty accessing care otherwise. And so we know that students with asthma may struggle to succeed, and that despite the existence of effective guidelines, treatment often is suboptimal. We found that healthcare and school partnerships can lead to improved symptoms, and our hope is that this will also lead to improved participation in activities, decreased absenteeism, and enhanced school engagement and attention to ultimately lead to improved academic outcomes and school success. So going back to Joshua, our hope is that he can be screened through school, he can be identified and receive consistent, effective preventive medications, his symptoms can be better controlled, he can sleep better at night and have less absenteeism, and ultimately have improved performance in school. Thank you.
Thank you very much, Jill. Okay, next up is Heidi.